Hello, and welcome to the DFPS webinar on the foster care rate modernization effort. We're pleased that you could join us today and learn more about this very exciting opportunity. During the 86th legislative session, the Texas legislature directed HHSC in collaboration with DFPS to study the existing foster care rate methodology. HHSC entered into a contract with a public consulting group who are nationally known for their expertise in foster care rate setting. The PCG group analyzed Texas-specific data, looked at national research, as well as met with numerous Texas stakeholders in order to develop a report outlining changes and recommendations that could be made to the existing Texas foster care rate methodology. Key findings included in the PCG report included: 1, the current foster care rates do not clearly align to the cost of care. Their second finding: the current rate level system whereby rates can fluctuate for children based on assessed service level creates fiscal challenges. Third, the current rate development process is primarily retrospective. Fourth, the rate calculations mix retrospective costs with forecasted placements. 5, there is an over-reliance on fundraising to support contract requirements. And number 6, there is a lack of financial incentives and accountability in the rates. Based off of PCG's recommendations, the 87th Texas legislature, through the General Appropriations Act, Special Provision 26, directed DFPS to develop, with the assistance of HHSC, an alternative reimbursement methodology proposal for the 88th legislature to consider for foster care and community-based care foster care rates. DFPS is undergoing what has been named the Foster Care Rate Modernization Project. The current foster care rate methodology structure has been in place since the late 1980s, early 1990s. The Texas Service Level System took effect September 1st, 1988. As you know, many things have changed that impact the foster care system since that time. Advancements in technology, data collection, a dedicated foster care managed care system known as Star Health, and community-based care have all evolved since implementation back in 1988. Additionally, many stakeholders have voiced frustration that the current structure does not adequately recognize or align improved outcomes with the services delivered. The Texas legislature has provided an opportunity through this Special Provision 26 to really look at and define the foster care service continuum, the methodology that goes into calculating the cost of foster care, and collectively establishing a new foster care system in Texas. The goal of foster care rate modernization is to improve outcomes for children, youth, and young adults through the establishment of a well-defined service continuum that meets the needs of the foster care population and recognizes and compensates the caregiver for delivering high-quality services. In order to accomplish this goal, there are 2 objectives. 1, determine what kinds of services are needed and clearly define each of the needed service models. And 2, establish a new foster care rate methodology that better aligns the cost of care with service provision and incentivizes improved child outcomes. The Rate Modernization Project has different categories of development as spelled out in Special Provision 26. First, as led by DFPS, we must clearly define a foster care continuum and different foster care models. This work incorporates provisions from relevant legislation coming out of the 87th regular session, including Senate Bill 1896 and Senate Bill 1575. Additionally, DFPS, through the establishment of a new service continuum, must also look at defining a new assessment and utilization management process. We will evaluate the use of the CANs and other tools to determine how to best use those assessments in the future to determine placement and determine child need in that system. HHSC is tasked with establishing new foster care rate methodologies to support the new continuum. Their approach will include conducting market analysis and evaluating cost report data in order to define new foster care rate methodology to support the new continuum. This work will include establishing methodology that supports community-based care as well. Lastly, DFPS and HHSC will collaborate and analyze child-specific costs as well as other costs and determine if there's enhanced methods for federal claim. The rate modernization includes 5 parameters from which the work is conducted. 1, newly defined models and continuum and rate methodology assumes provider compensation aligns service provision with the actual cost of care. 2, the scope of the foster care rate modernization project applies only to foster care services. This does not include adoption rates or other rates associated with community-based care. The focus is solely on foster care services. 3, licensing and regulatory requirements, oversight and structure do not change substantially. If there were to be substantial changes to licensing and regulatory requirements, HHSC and DFPS would need to reevaluate the established methodology and determine if modifications are needed. 4, some providers may need to make significant business model changes in order to move forward under the newly designed service model continuum. And 5, additional resources and time will be needed by DFPS, HHSC, and potentially providers in order to fully implement the resulting continuum and rate methodology. This is not an effort that DFPS or HHSC can take on alone. There are many stakeholders that have been and will continue to be a part of the modernization process. They are outlined on the slide in front of you. The role of the stakeholder in this effort is to provide guidance in defining the service models, including staffing models and training, assist in identifying gaps in service types, ensuring that all allowable pricing elements have been considered in the development of the rate methodology, informing and assisting in selection of the uniform assessment tool or tools and the utilization management process, and providing feedback on quality and incentivized performance measures. DFPS is undertaking a decision-making approach, which is outlined here on slide 11. We have been and will continue to analyze and consider data. Stakeholders will be engaged throughout this process. We have defined the existing service continuum as well as used data and provider input to identify gaps in the service continuum and define new programs in which to fill those gaps. HHSC is working to develop the best approach to calculating rates based on the newly defined continuum, and then they will be engaging with stakeholders further in reviewing and refining the established rate methodology. DFPS will be engaging with stakeholders to identify a plan and tools for assessing the need and utilization management of children that aligns and complements the new service continuum and subsequent rate methodology. Special Provision 26 outlines a number of deliverables and milestones in the project. Some rely on DFPS as the lead and others rely on HHSC as the lead. The first 3 items listed under deliverables have already been met. DFPS in September released a preliminary report outlining the preliminary service descriptions. Additionally, HHSC released an implementation plan for the development of pro forma modeled rates and cost reports in September as well. And DFPS in January of 2022 released a report detailing the DFPS final service descriptions upon which the new rate would be based. There are progress reports that are due at 6-month intervals leading up to a plan that is due to the Texas legislature in December of 2022 that includes the pro forma modeled rates using the new rate methodology and the fiscal estimate of implementing these new rates. Additionally, in February of 2023, HHSC, in collaboration with DFPS, will release a report on the feasibility of increasing federal funds for use in providing these newly established services. As discussed on the previous slide, there have been 2 reports regarding the agency's service descriptions that have been released. One was in September of 2021, and another released on December 31st of 2021 outlines the service descriptions for the new service continuum. Workshop participants and all all stakeholders are encouraged to read both reports to get a good understanding of the service descriptions as outlined that will support the new foster care rate methodology. DFPS has researched and provided the content to support the final service packages. However, to ensure these service packages meet the high quality envisioned with a new rate methodology, the department, in conjunction with HHSC and the University of Texas, Texas Institute for Child and Family Wellbeing, will continue to work closely with child welfare industry stakeholders to ensure and validate our assumptions underlying the new service descriptions and subsequent methodology. A series of workshops have been scheduled for late January 2022. Additionally, DFPS, in conjunction with the University of Texas, will be releasing surveys to providers and other industry stakeholders to validate the underlying assumptions in the service descriptions. If you have been asked to participate in a workshop, we have outlined on this slide relevant parts of the final service report that may be of interest to you and would be important to have a good basis for as you enter your work in the workshops. If you are a child placing agency and will be attending a workshop session devoted to foster family care, you're encouraged to read the report, particularly paying attention starting on page 5 to the service descriptions outlined for foster family care. Additionally, if you are a general residential operation and have been invited to participate in workshops relevant to general residential operations, we encourage you to read the entire report, paying particular attention to the service descriptions outlined on page 25 and page 41. Service descriptions included in the report include foster family care and a package of 11 different service add-ons. Those service add-ons, there is detail provided for those service add-ons in the report. They include basic foster family care, which is similar to the service components required in today's system for the basic foster family care. Additionally, there are new services such as short-term assessment and stabilization services, services for children and youth with complex medical needs or who have been deemed medically fragile, treatment foster care services, transition support services for youth and young adults, services for children with IDD or autism, services for children who may have been victims of human trafficking, support services for youth and young adults who are pregnant or parenting, services, substance use support services, services for children who are sexually aggressive or who have been adjudicated sex offenders, and lastly, services for children with mental and behavioral health needs. You're encouraged to review the report prior to the workshop sessions relevant to each of these service add-ons. Another part of the continuum outlined in the final report are for general residential operations. General residential operations are broken into 2 tiers under the rate modernization system. Tier 1 focuses in on treatment services. You'll see a list on this slide of 9 different service add-on packages for Tier 1 services. The final report details the service descriptions for each of these 9 services. If you're participating in a workshop dedicated to the provision of general residential services, you're encouraged to read up on each of these services prior to the workshop session. Tier 2 services for general residential operations are subacute stabilization services. These services are intended for children who are dysregulated and having a hard time stabilizing in order to receive good treatment intervention. These are short-term services meant to assist in the stabilization of children so that they can step into either a Tier 1 service or into a family foster care service package. DFPS is in the process of piloting the Qualified Residential Treatment Program model. Information gained from the model will be used to further define GRO Tier 2 service packages. However, all the requirements inherent in the Family First Prevention Services Act to serve children, youth, and young adults have been included in Tier 2 services. Additional analysis has resulted in 6 different areas where the department will be focusing in attention for the Tier 2 services. Children with severe aggression or defiance, children with substance use disorders, severe substance use disorders, children who may have been victims of human trafficking, children with severe sexual aggression or who've been adjudicated a sex offender, children with severe complex medical needs and severe complex mental health needs have all been identified as subpopulations who will be a part of the Tier 2 service description service add-ons. As mentioned throughout the presentation, DFPS is relying on the child welfare stakeholder industry to help in the validation of underlying assumptions and descriptions included in the final service report. Following the provider workshops, additional information will be gathered through a survey to all providers to support the validation in the final report. The validation is expected to be completed by the end of February 2022, and therefore it's critical that providers participate in both the workshops and complete the survey timely. This is the opportunity to weigh in on the assumptions and the descriptions that DFPS has put together. The assumptions and the descriptions that have been put together in the report will be the basis for the new foster care rate methodology. This validation will be used by HHSC to create the final rate packages. Our next steps include engaging providers in the workshops and the surveys to help validate the service continuum models, and that's to be completed by the end of February. We will continue to collaborate to solidify the foster care rate methodology with HHSC and stakeholders, and DFPS in 2022 will undertake the development of the assessment tool to support the new service continuum. We encourage you as stakeholders to remain engaged in this project. We cannot do this work without you. If you have questions, comments, or need additional information on this project, you're encouraged to email us at DFPS rate modernization, all one word, at dfps.texas.gov. We thank you for all you do for the children, youth, and families of Texas, and are very appreciative of your participation in the upcoming workshops and survey. Thank you.